Dr. Janssen, again, we're going to demonstrate what you can do with a foam roller. Now, a lot of people use a foam roller to stretch and roll out kinks, all that kind of stuff, but we have a lot of people that can't take that much fun rolling the foam roller over their IT band. So they still get the foam roller and they can use it. Well, one of the things that I like is the people that have too much curve in their mid-back and their head sits forward on their torso and their mid-back's real stiff, we have them lay on the foam roller. Okay, Noelle's going to demonstrate it here. She always makes everything look real easy, okay? And that's a disgusting part of the whole deal, okay? So what happens is you notice her head's on the foam roller, okay? Now, a lot of people can't do that. You need to have a pillow or something underneath your head. If you're laying your head back, okay, so it's uncomfortable, then you have to elevate your head a little bit. That means the muscles in the front of your neck are real short, okay? So the first time I got on the foam roller, I had too much fun in about 20 seconds and I got off. Okay, now you notice the other thing is, so putting the pillow underneath your head, you want to be as comfortable as possible on this. The other thing is that you want to have your arms on the floor. Okay, so she can put her arms anywhere that she wants as long as the arms are on the floor. Okay, so she can bring them up, but if the arms come up off the floor, then she's working her pec muscles instead of stretching them. So what this does is it stretches the pectoralis muscles, the chest muscles, okay, and it also helps increase the flexibility of the thoracic spine. Okay, so let's turn you around here, Noelle. Heads are the other way. There you go. Okay, scoot down there. See how easy she does that? That looks ridiculously easy. It's not, okay, but it's real good for people that, okay, sit all day long. See how her forearms are on the floor? Her head's on the foam roller. Okay, so if she was uncomfortable laying that way, then what would happen is we'd put a little elevation underneath her head. Okay, now the first time you do this, if you hate it, okay, that means that you're real stiff in your thoracic spine, and it means that your neck muscles are real short. So maybe the first time you do it, 15, 20, 30 seconds, okay, get off of it. Okay, you don't want to continue to lay there and suffer. The big deal is that you do it and you have continuity. So you come home from work, you're tired, you're worn out, lay down on the foam roller, and after a few months probably, you'll be able to lay there for several minutes and you'll notice that your mid-back won't be as tight, and you'll also notice that you can put your head on the foam roller. That means you've stretched out these muscles, which are real important for your neck.